New Yorkers will not be taking off their masks anytime soon. Governor Kathy Hochul has extended the state's indoor mask mandate to February 10th, surpassing the original February 1st date. Hochul says future extensions of the mandate will now be considered every week or two. Good evening, I'm Mary Alice Demler. Scott is off tonight. Now, the mandate comes as COVID cases continue to decline, so many want to know, are the masks even helping? Channel 2's Rob Hackford spoke to a local ICU doctor about the progress he's seeing firsthand. Rob?
Yeah, that's right, Mary Ellis. Dr. James Harris is a doctor with Kaleida Health who has spent the past 2 years of this pandemic in and out of the ICUs at Buffalo General and Millard Suburban. He says right now fewer people are requiring intensive care treatment. That's the good news, but at the same time, there are other pandemic-related medical challenges that are keeping hospitals very busy.
The sheer number of people who are in the ICU, primarily due to COVID, is lower, but we are dealing then with the side effects of this pandemic as well.
Side effects like blood shortages and staff shortages, even a lack of medication, that Dr. James Harris, an attending physician at Kaleida Health, says are still crippling a health system that wasn't designed for COVID. But with the news about the state's mask mandate,
so we'll be extending that just through February 10th.
Harris says folks are probably asking if cases are going down, why is there still concern about COVID spread?
The reason being is that we do not have the bandwidth in the U.S. or in the world for healthcare to deal with this particular virus and deal with the usual strokes, heart attacks, cancers, and regular surgeries that need to occur.
A dilemma that can't be fixed overnight. What can be, Harris says, is education about healthy living. He says people in good health who are vaccinated and boosted rarely end up in the ICU. And while some vaccinated individuals are ending up in the hospital, Harris says it's often the person's immune response that's the problem and not just the vaccine. In those cases, treatments like monoclonal antibodies have improved outcomes.
We're talking about population medicine. How do we treat the population so that we can protect those individuals who do not have an appropriate immune system?
As for mitigation strategies like masking and social distancing, while Harris says they may or may not be foolproof, as a doctor who decides who needs intensive treatment,
if that helps such that there's just one person who didn't have to come to the ICU, that's one more bed that's available.
For a family member or other person in need of emergency care. In Buffalo, Rob Hackford, Channel 2 News.